Today we had the National Health Assembly in South Africa, which is preceding the Global Health Assembly of the People's Health Movement. Our aim with this session today and tomorrow is to bring together activists from throughout the country who are working around health issues. So we have community health workers, we have people living with HIV, we have specialist doctors, we have public health practitioners, and we have lay people who have an interest in healthcare, who all come together now to discuss the crisis within our health sector, the social determinants that result in ill health, and the new proposals coming from government around national health insurance.
For example, we have very high levels of undernutrition in this country. About 20% of children are too short for their age, which reflects a poor diet over a long time. And this hasn't changed very much. And when we look at what food they're eating, we find that both adults and children have very, very poor quality diets, leading to anemia, vitamin A deficiency, zinc deficiency. And all of these contribute to these high levels of stunting or poor growth.
South Africa, I think, has two main things that impact on health. The one is our legacy of apartheid, where people were disenfranchised, oppressed and exploited on a racial basis for hundreds of years. And we have inherited the legacy of that inequality and poverty. And the second major issue that's special in South Africa is HIV, which affects a huge percentage of our population and interacts in a negative way on other health aspects within the people, within the communities, and places a huge burden of disease not only on the individuals bearing it, but on the health system itself and on the economic status of the country as a whole.
Continuous informed consent, because a mine has a long lifespan, and at each phase of mining has severe impacts on health. It has impacts on the psychology and also physical well-being of individuals. Particularly women are affected by mining in Southern Africa, but also it has impacts on the health of mine workers in terms of respiratory diseases, as well as the impacts of accidents and so on, and a variety of other impacts as well. The pollution of water, the pollution of the air, the destruction of the land and so on also has eventually health impacts on communities as well as on individuals. First problem is a large portion of mining. HIV/AIDS is a very serious problem in Southern Africa. Mining towns in Southern Africa have double the infection levels to other towns where there's no mining. This has to do with the labor regime that operates in mines, particularly the use of migrant laborers instead of local labor contributes greatly to the use of HIV and AIDS, because migrant mine workers are single and they look for sexual entertainment, and they find this from sex workers, and so in mining areas HIV/AIDS is rampant.
The main purpose of the workshop today was to show what children can contribute to a new public health program. And we believe unless children are involved as active participants, not only as beneficiaries, we are not going to succeed with anything. And that applies to everything else we want to do, whether it's literacy or food security. Half the country's population should be involved, because children are constitute almost half the country's population.
I think it's very important, and I'm proud of this program. Teach us about the lives, everything. Teach us about how are you growing up when you are a person, how to grow up. They teach us about all that stuff.
I'm hoping that we're going to grow PHM South Africa, that we will find new activists and new blood to infuse our current movement. I'm also hoping that we will come up with a set of concrete demands around what we want the new health system to look like. It's a very exciting time in South Africa that we have a new health system being formulated, and we want to make sure that it's a people-based primary health care type of system. And lastly, I'm hoping that we will build links with other organizations so that we can take forward these demands and struggle around them. to make sure that access to healthcare is something that is available for all South Africans.